Fungal infections are a big problem in all countries worldwide. There are fungal infections occurring in immunocompetent people and other fungal infections occurring mostly in immunocompromised people. I would be concentrated mostly in fungal infections occurring in immunocompromised people. That is, in people who have their immune system compromised because of some disease or like AIDS, HIV infection, or treatment due to cancer or other malignancies. The most frequent fungal infections occurring in these patients with a compromised immune system are candidiasis, invasive candidiasis, and invasive aspergillosis. There are also other fungal infections occurring in these patients like mucormycosis, fusariosis, and other less frequent infections. In general, fungal infections have a very bad prognosis and need to be treated vigorously. Specifically in children, they may occur in immunocompromised children, but also in children who are immature, like neonates. In this case, invasive candidiasis is more frequent than other fungal infections. As I said, fungal infections like candidiasis and aspergillosis need to be treated, to be diagnosed very early and immediately be treated empirically initially, and afterwards by specific active antifungal drugs. Sometimes we also need to treat these patients with surgical procedures, taking the fungal, the infected part out of their body. The most frequent sites of invasive candidiasis are the blood. Usually we see blood-borne infections, bloodstream infections, but candidiasis can also cause infection of liver, spleen, brain, and other organs, deep tissue organs of the body. Invasive aspergillosis can be seen in lungs, can cause pneumonia, but also can be seen as a central nervous system infection, brain abscesses, or infection of other sites of the body. The antifungal agents used are amphotericin B. This is a very old but very active also drug up to now. Nowadays we have amphotericin B in better forms, less toxic forms, together with lipids. We call them lipid formulations of amphotericin B, which are less toxic for the organism. And we also have azoles like voriconazole, posaconazole, and fluconazole. Those are drugs with different activities against different fungi. I think, as I said, the invasive fungal infections, especially in immunocompromised patients, are a big problem. They have very large rate of morbidity, but also considerable mortality. So we really need to treat them as quickly as we suspect them and diagnose them. Thank you.